Earlier this month, Geiger Gibson Community Health Center celebrated 50 years of being the first community health center in the U.S. with a golden anniversary gala. What began with roots in the civil rights movement as the nation's first community health center in 1965 has grown into a model that serves 23 million people in more than 9,000 locations. And it all began on Columbia Point in Dorchester. Originally named Columbia Point Health Center, the center was renamed in 1990 for its founders, Dr. Jack Geiger and Dr. Count Gibson, with a new building and a reinvigorated mission to continue to make sure that low-income folks have access to quality health care. Now, this morning, it is our pleasure to introduce you to the President and CEO of Geiger Gibson Community Health Center, Daniel Driscoll. Also with us, Murielle, a retired 34-year employee of the health center and a 60-year resident of Columbia Point. Welcome to Urban Update. Thanks for coming in, and congratulations on 50 years. Wow. Dan, let's start with you, some brief history. Not only the first community health center in the country, but it has roots in the civil rights movement. Now, most people don't know about that. What can you tell us about that?
Well, Jack Geiger and Count Gibson, the co-founders, were also instrumental in organizing the Medical Committee for Human Rights, which was the medical arm of the civil rights movement. They met during the marches in the South back in the 60s. Jack had, earlier in his life, been to South Africa and had visited with Dr. Sidney Kark, who had founded the community health centers that served the apartheid townships in South Africa. When Jack came back to this country and met up with Count Gibson during the civil rights marches, they made a determination to start programs like that for the low-income people in this country.
Amazing. Now, before I go to Murielle, I guess, who actually lived through all of this, we've got a little video we want to take a look at, which captures exactly what you just talked about. Dan, let's take a quick look.
It was not a hopeful time.
Ambulances wouldn't come into the community without a police escort.
There was a lot of fear in the city. There was really no healthcare vision at all.
Going to City Hospital, sitting for hours waiting. You never saw the same doctor, but you didn't have any place else to go.
One long look at Mississippi, and I realized I didn't have to go to Africa or Southeast Asia or Latin America. Poverty and lack of access to health care, we all had that problem here.
Jack Geiger saw community health care as an essential part of the civil rights movement. It began with residents being organized and eventually led to empowering communities in the broadest context of improving overall health. Both doctors Jack Geiger and Count Gibson, who were from Tufts Medical School, envisioned community-based neighborhood health centers that would treat the entire family rather than just isolated medical problems.
Wow, that's a piece of history there. And Murielle, well, you're like a walking history book yourself. 34 years at the center and 60 years at Columbia Point. Gosh, how are you feeling these days?
Very well, thank you, and very blessed to be here.
Now, you lived those days when it was really amazingly difficult to get quality health care at Columbia Point prior to the Community Health Center, did you not?
Yes, I did. And as I say, it was a police department should have been sent flowers when we opened, because we had to call them anytime there was an emergency to take our children to the hospital or any emergency at all. And that's why it was such a blessing when this health center came. Mm-hmm. We had people that would be sick on the street, and so many things that would happen that it would take time to wait for the police to come to get there or to get someone to the hospital. And that's why this health center coming was just heaven sent.
Okay. Now, Dan, over the years, there have been many changes, challenges, an important merger and a renaming of the founders, Geiger Gibson Community Health Center. Tell me more about all of this.
Well, all the community health centers in the country have as a common mission to serve everybody, regardless of their ability to pay. That leads to financial pressures. And in 1984, the Columbia Point Health Center ran into some serious financial difficulties, and there was some danger that they might not be able to continue. I was sitting at my desk at the Neponset Health Center in December of '84 and got a call from the Columbia Point Health Center saying, we need to talk about a merger because we're having some difficulties. Now, as you know, in that era, the Neponset section of Dorchester was an all-white, predominantly Irish Catholic community. The Columbia Point housing project was one of the tougher housing projects in the city. It was, on the face of it, an unlikely merger. But the two boards of directors got together and looked past their obvious differences and came with the common purpose of we need to preserve community health center services in our neighborhoods.
Now, Murielle, for you and many others, it has not only been a place of health care, but also a source of income and employment. You worked there 34 years.
Yes, I did. And not only was it I only, but many other people got a chance to work there, including my children. One became a nurse from training there, another became a dental assistant from training there. And it was wonderful for people to be able to get employment there to move on to something else, where ordinarily they wouldn't have expected to be doing anything other than, being home and just raising children.
Dan, you just had your 50th anniversary gala. Was it a success? I understand it was.
Yes, it was a wonderful success. It was a two-day celebration. We had over 300 people there, residents of Columbia Point, staff members, alumni, former staff members. The mayor, Martin Walsh, was our state representative, and so now that he's mayor, he came.
And finally, I guess the last thing I'd like to ask you, 50 years, a model for 9,000 centers. What was the key? What do you think? What was it about this health center that allowed it to become a model for so many others to follow?
The community health center model that Jack Geiger and Count Gibson founded, and which they interested Ted Kennedy in sponsoring at the federal level, struck a chord. It provided employment, it provided health services regardless of ability to pay, and served in a big gap in rural and urban areas all across the country.
Okay, and we'll leave it right there. Daniel Driscoll and Murielle Rule, thanks for coming in, and congratulations on 50 years of success.
Thank you.
Thank
And
you
being
for
a great
having me here.
model for so many others. When we come back, the growing number of homeless men and women and what you can do to help. Details right here on Urban Update.